Hi, my name is Dr. Leah Deaton. I am a clinical education specialist with a background in nursing. I work currently at St. Louis Children's Hospital in clinical education and research, but I'm not really before you in any of those capacities today. I am before you as a BJC Health Resiliency Champion, which just means I am a big old nerd for all things resiliency and change management and positive psychology. And they've given me a little bit of time with everyone this Nurses Week 2026 to share some of that passion and some action items that you can put in your tool belt as you work in the wonderful profession that is nursing. So we are going to talk about change fatigue, and I'm sure that no one here is surprised that that is a hot topic right now because we are inundated with change. Our profession, both globally and locally, is under constant change, right? Our patients are sicker, the care we're providing is more complex, and on top of that, we have all these systems that are changing around us. So I am going to talk to you a little bit about that and give you some evidence-based tools that you can apply to your practice in relation to change fatigue. So what kind of educator would I be if I didn't start with a definition? So I have here for you the definition of change fatigue, and it is really just this general sense of apathy or passive resignation. It can be felt by individuals or teams, and it's said to come around when too much change is happening, big changes are happening, or like back-to-back changes are happening. If it sounds familiar, that's because we're all living it right now, right? But why? Why does our brain resist change so much? Why is change so fatiguing? Well, let's talk about that. So what if I told you that our brains have actually evolved to really dislike change, to be very uncomfortable in change? It actually comes down to three different components. The first is threat. Our minds do not like this idea of threat, and that's because, many years ago, if we saw a bear in the woods, our brain didn't want us to stop and think at all about that. It wanted us to get the heck out of there. So that's why we get dosed with this lovely big cocktail of hormones, stress hormones. We get adrenaline, we get cortisol, to get our butts in motion and avoid the threat. So the first challenge with change fatigue is this idea of threat. We feel threatened and we get this lovely cocktail. The second is uncertainty. So lots of interesting research on uncertainty. One such study showed that people who had a 50-50 chance of being hurt if they touched this thing were actually more objectively stressed than the other group that had a 100% chance of being hurt if they touched this thing. So we would rather know for sure that something bad was going to happen than have a 50-50 chance. That uncertainty makes us extremely uncomfortable. And the third component is loss. Any change comes with a modicum of loss, a component of loss of autonomy, loss of a previous way of being. And that is also certainly something that's very uncomfortable and something we want to avoid. So change management at its core is really about helping people overcome this natural tendency or this natural wiring to be uncomfortable in change, which is great, easy, right? Let's just change our biology, our natural programming. Well, it can be done, but it's difficult. It takes intention. It's not a passive process, right? And my goal in the next couple minutes is just to give you some tips and tricks to not just suppress the feelings brought on by change fatigue, but instead to address them head on. So we're all going to experience change fatigue a little bit differently, right? It's going to feel differently in all of our bodies. So my challenge is, what does it feel like for you? I've put some examples up of what it could feel like. I have a buddy who I showed this to, and she said, well, where's cussing on this list? I said, I don't know, I guess irritability. But for me, when I am in the throes of big change, I recognize it because I will do everything but the task at hand, right? I call it fibrillation in my brain. I'm having electricity moving around. I'm thinking about all the things I need to do, but I'm not having any output, right? So my intention in sharing this list with you is really to help you identify your own response. When you're in the throes of big change, do a head-to-toe assessment on yourself to really recognize what are you feeling. That way, if you recognize what's happening, you can do something about it. So the BJC Resiliency Program utilizes these 5 kind of integrated components that you see to grow resiliency skills and behaviors. And each of these components, or petals of the resiliency flower, swag, can be involved in managing change fatigue. So we're going to go through each of these, discuss each of these 5 components, and talk about how they integrate with each other and how they can affect your experience with change. So the first evidence-based concept that I want to discuss with you all is finding meaning. And you might be thinking, Leah, of course what we do has meaning. We're nurses. It's one of the most meaningful positions anyone can hold, right? Yes. But how often are you thinking about change in terms of meaning? How often are we confronted with a change and I use my I voice. I immediately look for what are the barriers, what's going to be difficult about this, what are the challenges, instead of, well, how's this going to help me, or how is this going to help my patients? And that can be really grounding to think in those terms. And maybe this sounds familiar. Maybe you've heard from seasoned coworkers like, well, you think this is hard. In my day, we had to chart on stone tablets, did barefoot in the snow, I don't know, uphill both ways. And it's true that in our careers as nurses, whether they are long or short, change is a constant. So I challenge you all to think about a workplace change or an initiative that's really affected you in your role, your workflow, and maybe something that was painful at the time that it went live or was introduced. But now you can really recognize it as necessary, something that helped you in the long run or helped your patients. I'd love for you to share in the chat if you're thinking of one. It is hard to pause when confronted with change and consider the outcomes, but it does help find meaning in the work. It helps you find your place, your role in how the change will progress, and it gives you a sense of control. So the next thing I want to talk about is self-care, and I have for you this circle that demonstrates what happens when you're exposed to a stressor. So you see the stressor there about 1 o'clock, and then you see this cascade effect of everything that happens. Your fight or flight gets involved. You get that cocktail that I was talking about of hormones, and you can see right around 9 o'clock that you have a choice, right? You have a choice to either linger kind of in these feelings that are brought about by change fatigue, which can have long-lasting sequela, or to deplete the cycle. And we have in the center of this circle some evidence-based ways that you can do that, and you'll see a lot of them are self-care related. Some people hear self-care and they think, great, Leah, I have to take care of everybody else, and now you want me to do all this extra stuff for myself. But self-care can really be something you're interested in. Explore, see what fills your own bucket, and be intentional about completing this cycle so that these stressors or these difficulties, these feelings that we discussed in previous content don't linger. The next topic is around relationships. So, based on a recent survey that we had in our own system, we found that coworkers just having your back has a huge impact on resiliency. And we need to think about these relationships, particularly in times of change. It's more important than ever that we are leaning in to that connection and to almost over-communicate with one another. In surveys that were conducted post-COVID, we talked to a bunch of nurses and asked them what was most meaningful, what was most helpful to you in these difficult times. Overwhelmingly, the response was talking to my coworkers, sometimes, these little after hours gatherings or just opportunities to share our experiences with each other, because I can say in my own practice, I've found that people outside of healthcare, they don't really get it, right? Healthcare is very unique, so it's important that we find our people, our tribe, our person, whoever it is, who, as Brene Brown says, our person that really has earned the right to hear our story, because it's an honor really to hold this space for each other. So find your team, find your person. The danger in these times of constant change or big change is that we push each other away. We don't want to be a burden to each other even, but when in fact it's that connection with each other that really helps see us through. So prioritize this. Please prioritize your relationships. Okay, so for the next concept, really centered in self-awareness, I want to introduce two concepts to you, or two words. The first is agility, and that is our ability to quickly respond to challenge, to put out fires as they are happening. It's that in-the-moment flexibility, whereas adaptability is kind of the long-term resilience and strategic planning involved in navigating kind of these fundamental shifts, these big shifts in the market, in the industry, in our work, and you really have to have both. I like to think of agility as putting out fires, whereas adaptability is fire prevention. How do I keep the fires from happening? And what does that look like, in your role, in your work? It might look like setting boundaries, setting goals for yourself, planning ahead. And my favorite tip is giving yourself space to prepare. I call it kind of the sacred time, or the sacred planning, pre-briefing, debriefing, thinking through what's coming and what's going on. What are my goals going to be? What do I need to do to keep myself safe? And that one might sound counterintuitive because we're so busy, but actually it's more effective in the long run if you keep that sacred time for yourself. The next tenet of resiliency I want to talk about is optimism. And I'm going to be honest, this is where I lose people, because they hear this word optimism and they think, oh great, Leah wants me to fake happy all the time. But that's not true. I'm going to challenge that kind of understanding with this definition from Simon Sinek. He says optimism is this undying belief that the future is bright, but it's also rooted in realism, right? Optimism can accept that the times that we are in now can be dark and difficult. It doesn't ignore the hardships. It doesn't pretend like they don't exist, but it also doesn't get stuck there because there's this overwhelming sense that we're going to get through it, right? So how do we do this? The simple tool is practice optimism. How are you going to do that? Celebrate all of your wins, big and small. And it's more than just, a high five or a pat on my own back. It's you looking for the evidence that you have been successful, looking for the data that proves to you that, man, I have come through a lot. And by seeing that, you will look at the upcoming challenges as something that you can overcome. One of the easiest ways to do this is actually just to think of 3 good things at the end of every day. Be really intentional about it, not just, I'm thankful for shoe and glasses and hair, but what are you really thankful for at the end of every single shift? You can do it on your walk to the car or in your car, and by doing this, you actually shift something in your brain to scan the world for positives and instead of negatives. So I challenge you with that one as well. Really interesting research on that out of Duke. So you'll notice that none of these action items I've given you today or discussed with you are huge asks. I'm not asking you to change your whole lifestyle, but they do require intention. They aren't going to happen passively, and I think you'll be surprised on just the huge impact that they can have. And if this content is interesting to you in any way, please don't stop here. This short lecture has not even scratched the surface on all of the resources and the content that is available to you. As a gift, the Resiliency team has also created a guide for you to kind of walk through these steps, specific to change fatigue, to navigate your own experience and really come up with almost a care plan just for you related to change fatigue. We also have a resiliency website and facilitated programs that you can explore. And if you're interested, become a champion like me and share this message throughout your departments and your entities. So in conclusion, to wrap all of this up, I really wanted to end with a really strong finishing message. It's an honor and a privilege to have the ear of potentially every nurse in BJC Health. And so I did what anyone would do. I went to ChatGPT and asked him what to say. And what ChatGPT created was lovely. It was pleasant. It was nice, but it was a little meaningless. It was a little superficial, right? It didn't have that human component, and really that's what nursing is about, right? A robot doesn't know when your patient is scared and they need you to squeeze their hand. That's us. That's you and me. So I went to my colleagues instead. I went to my nursing friends in my own entity and at others and asked them, if you had 1 to 2 sentences you could say to every nurse in BJC Health, what would you say? And their responses were beautiful. They were pragmatic, they were real, they were appreciative, they were proud of our profession, and more than anything, they were just really, really respectful. So I want to give you all the same opportunity. Please use your chat feature. If you could say anything, 1 or 2 sentences to all of the nurses in BJC Health, what would you say? I'm so interested to hear what you're thinking and what you would share with your profession. And I'll end with a quote. It's not my own quote, but it is of the late, great Jerry Springer, American hero. At the end of every single episode of the Jerry Springer Show, he would always say this, and I want to share it with you, and I mean every single word. Until next time, take care of yourself and take care of each other. Thank you.